minutes, Surbi. Program, sir, please make it YouTube live.
Yes, ma'am, कर दिया live कर दिया.
Okay, thank you.
Okay.
Yeah, continue.
Good morning, everyone. A very warm welcome to one and all present here. Today, we all have gathered here for the KMB International Series of the Psychology chapter, What Do Health Psychologists Do? Organized by the PG Department of Psychology, Kanya Mahavidyalaya, Jalandhar. Kanya Mahavidyalaya, Jalandhar, the heritage and autonomous institution of women education, has been recognized as a premier center of higher learning for women in North India. This glorious college strives incessantly to emancipate, enlighten, and empower women across the globe. Ranked number one college of India by the India Today survey of top colleges 2020 and Outlook magazine, KMV is richly blended with tradition and modernity to create an ambience conducive to the holistic development of the students. Recently, this splendid institution organized a grand commemoration to celebrate the completion of 3 successful years of autonomy. Vice chancellors, academicians, and scholars from all over India highly appreciated the accomplishments achieved by KMB under autonomy. It was a matter of great pride when Kanya Mahavidyalaya signed an MOU with the prestigious Ecological University in its plethora of achievements of the international collaboration, which will include the exchange of psychology students, faculty, joint research activities and publications, and exchange of academic materials. Recently, KMV students and a faculty member of the PG Department of Psychology has been granted bilateral state scholarships for summer university courses. Let's have a quick glance at a short video on this international collaboration. This significant event today has been organized under the sharp and focused supervision of our esteemed Madam Principal, Professor Dr. Atima Sharma Dwivedi, an immaculate leader of the team KMB, whose transformation and progressive approach towards education provides us with such innovative and unique programs. KMB fraternity continues to nurture itself more under her supreme vision and guidance. I take immense delight in introducing to you all our distinguished speaker of the day, Dr. Robert Urban, Professor and Head of the Department Personality and Health Psychology, Eötvös Loránd University, Budapest, Hungary. Dr. Urban is teaching psychology subjects on different levels, including BA, MA, PhD, and other postgraduate training in Hungarian and English language. His research interests specifically are adolescent smoking, smoking cessation, alcohol use, theories of health behavior, application of psychology in epidemiology and health promotion, and many more. With an enriching teaching experience abroad, Dr. Robert is indeed a multifaceted personality who has richly contributed his expertise in the field of health psychology. Sir, it's an honor to have you today amongst us. Over to you, sir.
Oh, thank you very much. It's it's an honor. It is an honor to be here. So therefore, and thank you for inviting me to have this talk. and I was thinking of about the topic, what I would talk about, and then I decided to talk about my favorite topic is health psychology, and what exactly health psychology. Some students already participated in my classes on health psychology, so they are quite knowledgeable on this, and other students may not yet, maybe later. So therefore, I decided to talk about what health psychologists do. So therefore, I start sharing my presentation, and the title of my presentation: What do health psychologists do? What does health psychologist do? I'm sorry. And sometimes I make grammar mistakes. So what does health psychologist do? So let's start with the job description. Okay, what they expect from us as a health psychologist. Okay, I find three job descriptions, so then we can have a wider perspective where health psychologists can work. So the first job description is from US, and this is actually a real one. So it is not a constructed one. This is a real announcement. So it emphasizes that in this job, the health psychologist provides clinical services for whom. They provide clinical services for patients with psychological complications that are either a result of a serious medical illness. So therefore, it means that that the health psychologists can help these patients to cope with serious medical illness or other complication. But another that is the main focus of this job description, to provide clinical services. And what they do during these clinical services, what they expect from us to do in these clinical services, it means that active consultation with the clients, and also with medical providers as well. So, and one especially I like about health psychology, that it requires us to work in an interdisciplinary teams. So we provide patient care with working other practitioners, other physicians, nurses, physiotherapists, and sort of thing, and so on. So, and health psychologists also participate in other in evaluation process. For example, in evaluation for patients awaiting organ transplantation, or patient before a severe surgery. So that in this case, health psychologists can help us to understand what would be the most beneficial procedure for the patients waiting for a surgery. It doesn't mean that health psychologists make the surgery, but helps to understand the possible risks, and risks that may increase the possible complications after the surgery. And in this case, for example, psychologists can help can broaden the evaluation of the patient situation, and even if it's possible, if it's available for and it's for medical point of view, it is possible. So it is not an urgent surgery. So it means that maybe a psychologist may provide some psychological support or therapy before the surgery in order to prepare the clients for the more successful intervention. And as you see here, I just highlighted here in this job description that health psychologists in this workplace should work with clients with HIV and AIDS, or clients with renal problems, or cancer patients, and other type of clients. So what they expect as a knowledge in this job description, they expect us to provide intervention, to perform health assessment, behavioral health assessment, and sometimes to provide psychotherapy if it's necessary. Uh, um, and the other issue that we need, that in this job description they require to help the clients to manage chronic pain. So to have tools, techniques, approaches that can help the patients to manage the pain. And also, health psychologists also want to increase the motivation of the clients to deal with the issues. So sometimes psychologists should motivate the clients. Maybe the clients lost the motivations to do in order to improve their health or to adjust the conditions. So that's what we also do. And as you see here in this job description, they also require us to help veterans to stop cigarette smoking and improve health behaviors. So that's one job description. And the other one, as I find that just for an example, it is much more focused. So this is from Australia. In this advertisement, they are looking for a psychologist to deal with a specific type of disorders of the gastrointestinal tract. So in this, and that's another type of job description when we focus on specific health issues. And the last one is an institute that I had been lucky enough to visit a long time ago. This is the University of Texas MD Anderson Cancer Center. It is another type of job description, which includes either the treatment provider or a researcher position. So, and in this institute, they're looking for expert in treatment of obesity, or they're looking for psychologists who are interested in to develop new applications using digital health technologies. So the health psychologist can be applied health psychologist in terms of working in clinics, working with specific populations, but health psychologists can be also a researcher as well, developing new treatment, new approaches, new technologies. So after that, the description, you may have some view what health psychology is, and I put it here. The most frequently used definition of health psychology, which is, I think, after this job description is clear enough that health psychologist or health psychology as a field is applied to promote or maintain health. Or health psychology also used to prevent illnesses or treatment illnesses. So sometimes health psychology use alone or psychology treatment used alone as a treatment of illnesses, but more frequently psychology is used as a treatment beside the medical treatment or together with medical treatment. And also health psychology deal with the etiology and diagnosis. Etiology refers to the word of what causes the problem. So etiology is the causal explanation of a condition. And sometimes we need to health psychologists need to work with diagnosis, and it can be difficult and it requires lots of experience when we want to separate mental health issues from mental health issues caused by physical conditions or mental health issues alone. So for example, depression in some physical conditions like cardiac conditions and other, even cancer, even the disease or the treatment can cause symptoms which looks like a depression. Okay, so and that means that it is easy to misdiagnose this as a depression rather as instead of seeing as a side effect of a treatment. Okay, so therefore it requires a very careful attention to diagnostic and diagnostic procedure. And the last thing that has the last major task of health psychology is helping to improve healthcare system and improve and helping to develop a better health policy. For example, in times of COVID, health psychologists started to work on understanding how to promote the preventive how to promote the prevention against the transmission of novel coronaviruses. Okay, so before after seeing what health psychology is, I want to highlight three. Actually, I haven't corrected three approaches. I don't want to focus on the fourth one because that's much more a theoretical one, and three approaches that used in psychology, like clinical health psychology, public health psychology, and community health psychology. The fourth approach is which is not covered here, and that's why we have four. This is what we call critical health psychology. It is much more kind of a analysis of the power issues and how social inequalities influence our health. It is that's why it is not listed here, because it is not a unique practice of health psychology, but it's much more an overarching approach which is present in all approaches. So let's start with the clinical health psychology, because the vast majority of psychology students want to be a clinical psychologist. But clinical psychologist works mainly with the mental health patients with mental health problems or adjustment difficulties. Clinical health psychologists just use a much broader focus. They don't focus only on mental health problems. They also focus on patients with physical health problems. Usually they work in hospital or some clinics. And the approach of clinical health psychology is what we call biopsychosocial thinking. The biopsychosocial thinking means that we need to see the biological aspects of the person, the psychological aspects of the person, and social aspects of the person together. And because they interact with each other, they have influence on each other. So that's what the basic tenet of biopsychosocial model is, that these all aspects of the person have an interaction in health and in disease as well. And I just put it here. This is a nice figure that I like this, that you see the biological, somatic aspects, cognitive and affective aspects, they interact with each other. They have influence on each other. And also in the social aspect, which has different dimensions, including social support or family issues, family environment, or environmental stress. These are all just a few, I mentioned a few of the long list. And I put it here, which is I'm missing from this biopsychosocial model, is the behavioral model. That's what we could say it biopsychosocial behavior model from my view, because the behavior is one of the most important way how these all factors has impact on, and the behavior which are the determinants of our health. So again, clinical health psychology, the goal of the clinical health psychologist is to enhance the effectiveness of treatment, so or develop new treatment, or develop new complementary treatment. If you want to say, if you want to use this word complementary, and this also include assessment. I mentioned already how we can separate the mental health issue, mental health problems from the consequences of or side effects of a treatment or the consequences of a disease. They also provide therapy, consultancy. Consultancy may include psychoeducation. I think psychoeducation is a very important tool. Psychoeducation means we just provide information clients, to inform the clients, educate the clients about the process, and also the research as well. And I like this cube, and this is from one of the major figure of this field is C.D. Bellard, and her book. If you are interested in more that in this field, I strongly advise to read her books. So in this cube, we say that the clinical health psychology or clinical health psychologist work with different type of clients. That's a one dimension of this cube. So the clinical health psychology work individual, family, but clinical health psychologists also work with healthcare providers. What kind of work should be with healthcare providers? One major issue, especially in COVID with healthcare providers, that they are burdened. And that's what we call burnout. So they have symptoms of stress. They have also feeling that they don't perform well enough. They have psychosomatic symptoms as well. So in this case, even healthcare providers can be our clients. And also they are not only clients, but they can also be a partner or co-workers, and we need to educate them about the psychological issues that they may not be aware of. And the source and the society is also our client, because we need to train the society. We need to educate the society about psychological issues. So many stigma about psychology and about mental health patients, or those patients who have some psychological symptoms, is due to lack of knowledge or lack of understanding what mental health problem is, or what are the psychological issues present, for example, in a certain chronic condition. So that's one dimension of the work of clinical health psychologists. And the other dimension is what they do, and we already mentioned it's several times that we do assessment, or we provide intervention. It can be psychotherapy. Usually clinical health psychologists use a brief psychotherapies like CBT type of psychotherapy, cognitive behavioral therapy, or there are many other type of brief, shorter psychotherapies. And also consultations, which means that what we call counseling or consultation or psychoeducation, it is in this case we have our clients, individual, family, healthcare providers, or others, to to solve a current issue, a current problem um, um, without psychotherapy. It's just some simple consultation, including psychoeducation or just providing psychosocial support for the clients and sort of things. And just I put it here, why we need to work in collaboration with clinical psychologists. So clinical health psychologists and clinical psychologists should work together, and also they should work together with psychiatrists or other medical professionals. Um, because what happens that when someone has a mental disorders, that has also a possibility to develop other health conditions. So usually people with mental disorders have a higher rate or chance of having other risk factors. For example, depressed people are more likely to smoke cigarettes, or they are more likely to drink, to have problematic drinking pattern, because they want to treat their symptom. That's what we call um, that's what how we explain that this in this or some mental health patients, patients with mental disorders may have other risk factors like physical inactivity, overeating, and sort of things. But that's not only the reason. They also have common mechanisms, common biological mechanisms behind the mental disorders and physical conditions. It can be some genetic effect that causes both mental problems and physical problems, or environmental risk factors like child abuse can also lead to the problem of mental health problem, and also can cause physical health problem. And also the other thing that we need to consider that the other way, so that if someone suffers from a disease like cancer or cardiac conditions or heart attack or high blood pressure or some inflammatory diseases, it also has an impact on mental health. So since some disease processes directly affect the brain, so it may have mental health symptoms. Or just give a simple example that you can easily capture that for example, I don't know, India, do you have a flu season or just a simple flu season? And when you get a flu, an infection caused by flu viruses, influenza viruses, or just if you can just think of the COVID disease, COVID-19 caused by coronaviruses. Even those people who did not develop um, severe conditions, they may feel tired, weak. um, People who usually get viral infection, they may avoid social contact. They just want to stay in bed, or they want to be calm, etc., etc. This is what we call sickness syndrome and sickness behavior, and it means that the process, how the body processes the virus, which is through the immune system. The immune system works that way, that have impact on the brain. Because if you have a flu, or if you have a infection, it is much more useful from an evolutionary point of view. It's much more useful to stay away from others and conserve the energy. So this is a biological system. So now a biological mechanism. So nowadays they think of that maybe behind the depression, some depression, not all depressions, behind some depression, there is a kind of an inflammatory process in the body that causes depressive symptoms. So that is kind of a theoretical issue, and also practical issue is how to treat depression if it's caused by inflammatory processes in the body. And the last one, that some mental health disorder may affect treatment of the physical illnesses. Maybe because people who have mental disorders, they may delay help seeking, so they wait and they don't go, or they have difficulties in communication with physicians or with others. So therefore, they don't report their symptoms as early as possible. So if it's delayed, then in this case, the treatment is more difficult. Or mental disorders also contribute to decrease the quality of care. So we see in research that those people who suffers from mental disorders, they receive less good quality of care because they have difficulties in communication, for example, or they may have difficulty to get rapport with the healthcare providers. And also people who suffer from mental health problem, they may have a problem to follow what physicians advised or recommended. So after the clinical health psychology, we move further to see what is the other field of health psychology, which we call public health psychology. The public health psychology is derived from the Lalonde report or other report, which recognizes that the source of health in the society can be explained by different factors. And as you see, this is kind of a rough estimation how different factors are important in influencing the population health. So it's not about individual health, it's all about the population of, let's say, population of India or population of Jalandhar or population in Europe. This estimation is coming from US. It's not, it is not necessarily the true for example, India, the population of India. But what they see in US in the research that the genetic predisposition explains the 30% of the premature death is the outcome. So that is it is quite interesting because epidemiologists and health psychologists focusing on death. So because premature death is an indicator of unhealth or lack of health. Okay, so if someone died too early. So, and it means that it is defined 30% by genetic predisposition. But the other important factors here are healthcare, for example, is 10%. As you see that what we would say that healthcare is important in promote longevity or decrease premature death. But as you see from the population perspective, that the healthcare has quite a minor role. It's not a negligible role, it's a minor role in population health. But what is very important here is the behavioral patterns. What we can call it lifestyle, or it can include many different factors, but usually it includes some physical activity, eating patterns, smoking, alcohol, vaccination, uptaking vaccines, and many other behavioral factors. And also social circumstances important is 50%, and environmental exposure is also important. So whenever we want to, as the goal of health psychology and other health practitioners, we want to improve the health of the population, so decrease the premature death, we can focus on all factors, but the most beneficial one if we focus on the behavior patterns, if we focus on health behavior. And that's what the next field of health psychology is dealing with is um, is health behaviors and health promotion. And this field of health psychology is sometimes called public health psychology. Public health psychology. Public means that this approach is much, it's focused on the population or the large groups of people, not individual group of people. So the objective here is to improve the health of the entire population, and it requires to understanding the health issues, the current health situation. So therefore, public health psychology uses many statistic evaluation on the population level, because we need to understand where we start and what are the major issues in the population. And also, public health psychology deals with the development of health policy and other interventions to influence the current situation. And again, testing again, how the actual health policy or intervention worked in the population. So this is the field of psychology which is which uses research very heavily and also use interventions, measuring the impact of interventions. I just put it here, what is public health, and that is the understanding what public health is important nowadays, because that emphasizes that psychologists have important role in public health. That's what we call new public health. The new public health recognizes that the health of the population is derived from different sectors, different areas of life, and this new public health also emphasizes the behaviors, the importance of behaviors in health. The previous public health, the old school, emphasize mostly put emphasis mostly on medical aspects of public health. But new public health and it's new public health wants to emphasize that everyone is responsible to in the population health, from depending on the field. As a health psychologist, we usually focus on health behaviors. Okay. And the model, the thinking of the public health is what we call social ecological model. And I don't know whether you are familiar with Bronfenbrenner model, which is used also in developmental psychology, is that we all as individuals are embedded in what we call microsystem, such as family, school, peers, church, depending on the religion, but some church type, religious community, or health services. And these all systems interact with each other. If something happens in the family, that may have impact on the school, or vice versa. Something happens between among the peers that may impact on family, and they should work together. That is, these are microsystem as interacting with each other. And this interaction is described as a mesosystem. And the exosystem emphasizes that in all these systems is embedded in a larger perspective, like industry, local politics. We can start with local politics, or neighbors. Okay, so the family and schools are maybe the same neighbors, or social services, industry, mass media, and this all has impacted upon the attitudes and ideologies of the culture. So when we analyze health issues or health problems, we need to analyze it at a different level: individual level, the microsystem level, and exosystem and macrosystem level. But there is a much simpler way of doing that. Is another model by McLeroy, is emphasizing the intrapersonal aspects of health, like knowledge, skills, self-efficacy. Sometimes the psychologist provides information with psychoeducation, or train the clients to learn new skills, for example, how to relax, how to stay calm, um, or improve self-efficacy. Self-efficacy is about the belief that I can do some activity. It's a very important motivator of people to perform the required behavior. And the other level of influence in social ecological model is the interpersonal model. So we are all influenced by our families, friends, peers. And sometimes these interpersonal processes are beneficial. So they support us, they provide emotional support, they provide practical support or financial support, but not all the time. Sometimes interpersonal can be harmful. Interpersonal influence can be harmful. So in this case, we need to train our clients to work against the harmful interpersonal, like bullying is now a current topic nowadays, when peers bullies the weaker members of, of the peer group, or they may they maybe some wrong information, or other negative influence may happen. So that also should be considered. The organizational aspects, like different organizations, like religious organizations, or stores, or other communities. The communities are especially important in our lives. And these all organizations can also, again, promote our behaviors, and then they can also have negative impact on our health behavior. The community, another other level of influence, like social networks, the community norms, what we expect, what we think that what the community expects from us. And also the public policy. What are the laws? What are the policies? What are the regulation? And it's also another level of influence. And as again, just list another factors of health here. And I just want to show with this figure that as a health psychologist, we have to work on other sector, work with other sectors. Let's say um, we may need to work with engineers, how to build up a city, or city planners. I'm going to show you another example later, a little bit. Or we need to work with the food industry, how to promote more healthier food, and how to influence our eating habits. You know, the world suffers from a great obesity epidemic. So therefore, that one source of this obesity epidemic is due to the food industry, for example. Or we need to work on education, increasing the literacy. Literacy can means that how we can understand, how we can get the knowledge regarding our health, if it's about health literacy. But literacy in other ways can influence the success in schools and works and sort of things, which have also impact on the individual and also the family. And I just want to highlight again the early childhood education. Now we have many research which which support that the best investment in the society to improve health and wellness and prosperity of the nation, the best investment is focusing on early childhood education, the early childhood environment. Okay, that is especially important. But sometimes we just need vocational training to have the clients to move out from an oppressed situation, So to have more power, or what we call, that's a important word here, is what we is empowers. When we empower people to move from an oppressed situation, from a situation which against their health and well-being, with learning new vocation, and then gaining money, getting money, and etc. Especially important. Is and we also need to promote in those areas where the poverty is an important issue. The other field of health psychology, the third field, is community health psychology. The community health psychology, as a name implies, it works with communities. So the basic idea of this approach is that instead of the expert telling, instead of the expert, as an expert, we tell the community, we tell the people what they should do. Instead of doing that, we can ask them what they think that they need to do to improve their own health or quality of life. So it means that we increase the autonomy of the people, of the member of the community, to take actions to improve their own situation. So uh, just there is a proverb, I don't know it by exactly, but we don't give only fish to people, but we teach them how to fish, how to find fish in the lake. So, which means that, but it should this approach based on the community efforts, the community resources, and if the community find the most important, the most pressing needs that they need to change, and they will be involved, they will invest effort and energy to change the situation. But the question is, what is a community? And we can have different type of community. We can have community just due that we live in the same geographical area. So community can be a city, can be a village, but also community can be based on common culture, values, and norms, like adolescence, okay, or let's say Hindus, for example, India, or let's say in this case religious community. We can talk about religious community. Or the community can be based on same personal and social identity. It can be Black people or gay people, or we can put it here as a women. In some countries of the world, women are quite oppressed, and this can be also the community of women. And what is also important, that the members of the community are aware that they share their identity, and therefore they have the common needs. So in this community psychology, what we do, we just empower this community to take actions over the determinants of their own health. For example, in case of poor women, they recognize that learning new vocation would be helpful in improving their situation. So they put effort and they activate how they could do that, okay, how they can learn new vocations. So in this case, in community health psychology, we need other skills than the other field of psychology. We need to work with small and large groups. We need to facilitate the communities. We need to empower the community. We need to help them to develop their own identity or strengthen their identity. So it means that we go to the field and work with the communities, helping to build up coalitions, between researchers, practitioners, community members. There are plenty of methods to use that. So I just put here an example. It is an example for this community-based approach is what we call healthy city approach. Healthy city approach is how to increase the health of the city. And what they did that they selected cities, or cities just wanted to participate in this approach, a city as a geographical based community, and they did research, and they invited the inhabitants of each cities and asked them what are the things that they feel that important to change in order to improve their own health. And of course, each city may have different issues. So we cannot tell let's say as a scientist or an expert, we cannot tell that this city should do this and this and this. But the people living in the city can say, that's things that troubles me and that I want to change this. And then if the city agrees that, or a member of habitants or people living in the city agree with this goal, they can develop methods to change this issue, these problems. So as you see that in a healthy city put together from healthy people with healthy communities and healthy environments. And I just put it here an example of Cardiff. Cardiff um, is a city which participated in the healthy city model, and but they find its most problematic thing is the weight issue. Okay, food, physical activity, and weight. So that was what they find pressing need to change in order to improve their health. So they had what we call capacity building. So they learn new skills, new technologies. They develop organizations, and they develop different methods to understand how food and physical activity interact with other health aspects of them, and they developed strategies that may have to increase physical activity, for example, or change the food that are available. So physical activity can be increased with environmental design or health urban design, so that the city is designed to make people walk. Okay, so just help them to walk regularly or do physical activity regularly. And all of these aspects is influenced by local policies. So that was the Healthy City program. Is let's focus on one issue, is food and physical activity and healthy weight. So we are almost at the end of my presentation, and just put it here together that even if we talk about clinical health psychology or public health psychology or community health psychology, we can have different type of interventions working with different level of complexity. If in this case, young people or family of the young people, community and culture, and we have different type of intervention, from the prevention part to the different level of prevention or case identification, who are the problematic one, or treatment, or long-term care. But we can also work in different settings. We can work on families, schools, neighborhood, primary care clinics, and sort of things. So these are the complexity of health psychologist work. And that's what I like it very much so. And just we can jump this, and I just put it here. I looked for how health what is the situation of health psychology in India. And I find that this society, so if you want to learn more about health psychology in India, that is, I strongly recommend this Indian Academy of Health Psychology. They also, and on their website, they also provide trainings, they have lectures, and I hope that after your training, you may become some of you become a health psychologist, um, or may just develop a Jalandhar healthy city model for the sake of the health of the community in Jalandhar. Thank you very much. So if you have any question, I'm happy to answer. Oh, I cannot hear you.
Thank you so much, sir, for sharing your valuable dexterity on the indispensable field of health psychology and the pertinent role of health psychologists in various domains of life. I'm sure the students as well as the faculty members, they have gained a deep insight into this cardinal field of psychology. Now, I'm sure some of our students are quite inquisitive enough to get answers to their queries. So, students, you can raise your hand and ask questions from sir.
Yeah, there's already one question in the.
Yes, Jasmine, you can
Students,
unmute
you can
yourself.
also write your question in the chat box. Meanwhile, the sir is giving answer.
Okay. Um, there is a question.
Jasmine, you can unmute yourself.
Yeah, okay. Okay, go on.
Uh, Prabhram sir, please unmute Jasmine. Yeah, Robert sir, meanwhile, you can give answer to the student Manisha Soni. Her question is,
Can be okay. How health psychology can be used to treat the obesity,
yes,
especially the person who eats emotionally. So there are quite specific questions. So the treatment of obesity is quite complex. It requires psychological methods, and also sometimes it requires medical methods as well. So a specific question is about the person who eats emotionally. It's quite difficult to answer at this moment. It requires more kind of exploration of the problem. But if you want to get some um, techniques that, for example, emotional eating might be due to anxiety, might be due to depression, depressive moods, depressed mood, or might be due to whatever. It is quite difficult to say one techniques, but the role of the psychologist here is to help the clients to learn skills to deal with these emotions, and then if they can successfully deal with these emotions, for example, in case of stress, the relaxation techniques might be useful, or other methods can be useful. So therefore, it is in case of emotional eating, it is the way. I don't know whether it's answer. It's very difficult to answer because that would be another 1 hour lecture about the treatment of emotional eating. Um, and there was another question here, is that create awareness among children about the deteriorating eating habits. Again, the creating awareness usually requires psychoeducation. So just we need to provide information in the level how our client, in this case children, can understand it. But as for the children eating habits, it is also they are also influenced by the family. So I wouldn't focus only on children, because the decision of what children eat is eat that usually influenced heavily by family. So therefore, maybe the family needs some help to work with those eating habits that seems to be deteriorating. But yes, I see that so many questions about obesity and eating. Okay, so we could have a class on obesity. So if we pursue psychology as a career along with some other degree, that's a question here, and it is. This is it depends on the regulation of each country. So each country regulates the work of psychologists. But usually, being a psychologist requires a psychology degree. But it doesn't matter that those who are not trained as a psychologist, they can also use some psychological method, as we all as but they learn, but they cannot call themselves a psychologist. But they of course they need to work within their own specialty and use some psychological tools. Mhm. Okay, and any other? I see a lots of hands, so please ask.
Hello, sir.
Yeah,
I am
yes.
Jasmine Kaur, a student of BA Psychology Honors.
Mhm.
First of all, I'm really thankful to you for giving such a deep insight into this field of health psychology. Sir, can you tell us some good behavioral patterns for maintaining healthy lifestyle?
Excellent question. So that is because um, we know a lot about what are the behaviors which are good for our mental health, our, um, and and we can also use these lifestyles in treatment of mental health problems as well. So there are the most important ones that are emphasized in the literature is a physical activity. That now it's regarded one of the most important ones in maintaining health, the physical activity. What does it mean, physical activity? So doing physical activity doesn't necessarily means that doing exercise only. So the physical activity can be anything that in which we move regularly. And the recommendation is doing physical activity at least 20, 30 minutes a day, like walking, or it's especially walking a little bit, not walking, as we can feel that our respiration rate or heartbeat a little bit faster than usual. So or maybe we can have some sweat. So the other aspects of health behavior is eating pattern, what to eat, and amount of to eat. So we are stressed by the environment to eat much more than we really need. Um, the other important aspects of having good social contact with other people. So it means that having a circle of friends or spending time with other people. And we can also mention is going outside, to stay outside, in the nature, have a contact with the nature. That's also mentioned as a healthy lifestyle. Of course, avoiding smoking, alcohol, and other substances. Substances is also mentioned, and especially if someone has. I think that's all. That's we can list many specific factors, but of course, dealing with stress, that can also contribute to health and mental health as well. Yes, I don't know whether I give enough idea
Sir,
to
it's such
invest.
sir, since it's pandemic and we can't go outside our homes and we are just supposed to sit at our home. So what kind of activities do you suggest to an individual to which he or she can perform by merely sitting at home?
So yes, in this specific situation in COVID, the
Yeah.
going outside is difficult. Okay, that's I understand. So, but the COVID situation will be over. So, and then it is also just we keep in mind just being outside, being under the sun, and maybe in Europe, in India there are lots of sun, so therefore, but in Europe that's where. So at home you can do physical activity at home as well. So yoga or other activity. Just it is important that you do something that you like. Okay, so you don't force themselves to do something that you don't like, you don't enjoy. There are so many different forms of physical activity that you can enjoy. So try different things and do it regularly. The regularity is important. Do it regularly. Build it into your own life. Okay. And
Thank you, sir.
you can also have still keep the contact with your friends and the family through the online. The technology can help in
Yeah.
this.
Yes, sir.
Okay.
Thank you, sir.
You're welcome.
Hello, sir.
Yes.
Hello, sir. I'm
Yes.
Arzu.
Yes.
Sir, thank you so much for such an informative session. We learned a lot today, definitely each one of us. Sir, my question to you is online psychological therapy also effective? Does it work for some health disorder?
Yes, due to the technological development and other circumstances, some people, in this case, in the current situation, or maybe other circumstances, the on-site therapy is not available for people. And then nowadays therapists use online psychotherapy, and there are some research which shows that online psychotherapy can be also effective. So sometimes it may be more cost effective for the clients as well, or maybe more available. They don't have to travel, for example. So the online therapy can be useful. Yeah, that's clearly the research shows that it can be effective. Yeah.
Thank you, sir.
You're welcome. Any further question? I have.
Hello, sir. I'm Amandeep
Yes.
Kaur.
Yeah.
First of all, thank you so much for this wonderful session. Sir, my question is, does your work in therapy tend to be more focused on the past or the present? Do you need to see people for long-term therapy or for the shorter-term therapy?
In health psychology, it depends if it's useful to focus on the past or not. So in health psychology or in the behavior change field, so um, um, we try to stay in the present and in the future. But of course, sometimes we need to understand where some problems coming from. But what is the major focus is in my work is the behavior. Okay, so therefore we use techniques which help to change the behavior, like quitting smoking. In quitting smoking or quitting substance use, it doesn't necessarily important to know why people started smoking. That was a long time ago, and and usually starting smoking, for example, is influenced by different factors than keeping smoking. Okay, so so therefore it is not very meaningful to see what happened in the past when the person started smoking, and then we can focus on the current situation, what is now. But in some cases, other cases, we need to see what is what happened in the past. Okay, so there is no just a general rule that we don't deal with the past. Especially if we have a longer process, and then we need to focus also on the past as well. It depends. If it is helpful for the clients to focus on the source of the problem, that is important. If it's not, we just focus staying it here. What is the problem? This is sometimes it is called solution focused counseling, or the CBT is generally focusing on the present. Yeah. Okay, next question.
Good afternoon, sir.
Good afternoon.
Sir, it was a really amazing session, an interesting session. Sir,
Please
my question
unmute
is,
yourself.
sir, my
Yeah.
question is, what kind of measure does a health psychologist adopt to prevent stress?
Oh, the stress prevention. That is again, it could be a huge book. The stress prevention. So, in the prevention, the stress prevention can have different. We can use different methods. So, one method is, if it's possible, we can build up methods to avoid stress. Okay. But when the many stress situations are simply not avoidable, they are part of our life. Okay, now we can the other group of tool is focusing on how we think about the stress, and we can think about we can focus on the cognitive processes. So how we see sometimes just simple our thinking increasing the stress. Okay, so therefore it means that we use techniques which helps to which help us to identify is how we can manage the stress with the thinking of change. But sometimes the stress is going with the physiological changes and um, um, in the body symptoms. So in order to deal with them, we can learn relaxation techniques, different relaxation techniques, let's say progressive muscle relaxation, autogenic training, some form of meditations, mindfulness, and so on. So it is another tool. And then and the third tool is the sometimes the stress situation is solvable. It's something just a challenge, and we then in this case we learn problem solving skills. Okay, so there are many techniques that we can deal with the stress. And as a psychologist, we need to learn all of them, or many of them, because we don't know that what our clients would need. So therefore, we need to provide this this wide range of stress management techniques.
Thank you, sir.
You're welcome.
I think we're done with the questions.
Good. Anyone is going to? Anyone wants to become a health psychologist from the audience?
I think
Or not?
everyone, after your talk.
Okay.
Pavneet, you can unmute yourself.
Good afternoon, sir.
Yes.
Thank you so much for your informative session.
Yes.
My question to you is, does gender influence?
I didn't hear the second. Does gender influence?
Does gender influence stress levels post-diagnosis of cancer?
It's it's difficult to tell here because males and females have different types of cancers. Okay, may have different types of may have a similar cancer, but they have different types of cancer. And I don't think the gender is important here, and I think that what is important here is a personality. Maybe there is a minor difference, maybe, but I think it's more important the person's situation, the personal resources, the person supportive network, the way how the person sees the situation, previous experience, and I think there are myriad of factors. So it is I think simplifying it that into gender, it might misleading. If the gender is associated with all these factors, okay, in this case you could say yes. So that I don't know whether I answered to this question. Okay,
Yes,
I think
Kanika,
that
you
would be
can
the last
unmute yourself.
question. Okay.
Good afternoon, sir.
Yes, good afternoon.
First, thank you for such an informative and helpful session of yours. Sir, my question is, what skill do we need to be a health
I cannot hear the
psychologist?
question. Oh, I cannot hear the question.
Sir, my question is, what
Yes.
skill do we need to be a health psychologist?
Oh, you need to learn many skills. The most important ones are the counseling skills. Counseling skills. You also need to learn the assessment of the client and some basic psychotherapies, and you need to learn about those physical problems that you are going to deal with. Okay, so it's not a skill, it's knowledge of the disorders. So because the psychologists are usually trained in mental health problems, so whenever if you go to, let's say, cardiac units, or you go to the cancer unit, beside your psychology training, you need to learn all about cancer, all about cardiac patients, etc., etc., because you want to be able to have a discourse with your with the physician's colleagues and etc. And you need to understand what's happening during the treatment, what's happening in the patients during before and during the treatment. So actually, you need to train yourself to understand all the biological processes as well. And beside that, so you need to have the usual skill like counseling, assessment, connecting to do. So I think that the difference from let's say from a usual clinical psychologist is that you have to be open to learn these biological aspects of the conditions, and you need to able to good connection with physicians, nurses, etc. And it's not easy because in the healthcare settings, the hierarchy you will be always, even if you are a big professor of psychology, you in the hierarchy you will be below from physicians, okay, even from beginner physician in the high, at least in Europe, as what we can see. I don't know how it's in India. So, and that's what you can accept it, okay, in this field, and you have to be compassionate with your physicians as well, even if that's something that you can stand calmly. Is it did I answer? Okay. I think that's the session is.
Thank you so much, sir, for
Yes.
answering the queries of the students.
Yeah, thank you
Now
for such a good questions.
I extend my deepest regards to Madam Principal for always lightening up the pathway of bountiful opportunities for the students as well as the faculty members to attain excellence in all spheres of life. Heartfelt thanks to all the faculty members of the Internal Quality Assurance Cell for their constant guidance and support in organizing this event. I sincerely thank Parkram sir for providing the technical assistance throughout the program. Last but not the least, I thank all the teachers and students present here who have been an important part of this dynamic KMB International series. Stay safe, stay healthy until we meet again for yet another venture of the international series. Thank you.
Thank you so much, Robert sir.
Thank you so much,
Thank
sir.
you for your time.
Thank you very much for inviting me, and thank you.